All right, Andrew. So I wanted to kind of share my story about failing clinical boards. Which was back in 2007. I know I hear like a lot of posts, or I see a lot of posts on Facebook and places like that, where in the hygiene groups, where people talk about they failed boards and they're all stressed out, and it was really an awful experience. And I can definitely attest to that. It was really a awful feeling to fail. So let me just kind of start from the beginning. For those that are not maybe hygienists yet or haven't gone through this process, just kind of give a little overview of what we have to do to get a license. I think it's pretty much the same. Tell me if it's different in your state, Andrew. But
Okay.
basically, you take the national boards, which is a written exam with case
hmm
studies and general questions,
hmm
which is that's the real difficult written test, really.
I think it was like 8 hours or something like that. It was a
Yeah,
long
it was
one.
all day.
Yeah.
um, and I'm in the Northeast, so we took the NERB regional. So we took a NERB written test, which was pretty easy. That was an easy one. It was the national boards that was the one that was pretty difficult and challenging. And then we have a clinical exam, which we have to treat a patient, basically a perio patient. So those are the three things that we have to do, um, outside school and all that stuff. So the national boards, I aced it. I got really high scores, and the other, like the written, the written NERB test, and then my clinical was. I mean, basically, I didn't have the ideal patient. It's kind of half my fault, I
Mhm.
think. Um, as you know, Andrew, like in hygiene school, we basically, probably like the last year or so, you're looking for a board patient, which is, kind of like moderate perio type patient.
Right, right.
People are always on the lookout, basically. I kind of waited till like the last semester because I was kind of focused on one step at a time, as I went along.
hmm
Plus my brother had, I knew he had perio, so I was kind of banking on him being my patient, so I was less than aggressive, I guess, early on. But
hmm
still, so he basically came in, I did the probing and everything, and he was kind of borderline. Like he was maybe would qualify, but it was not really. He wasn't like the ideal patient. So I kept looking. I ended up having my cousin, which he definitely had perio. Um,
What was wrong with your family?
yeah, I know. Yeah, it's perio. It's perio. Definitely. So so he came in the clinic so I can, do the probing and everything, make sure he was
Sure.
good. And he was good. He seemed like he was going to be a good patient and stuff. And we took our clinical boards in April, and I don't think we got our test results till like, I don't know if it was late May or early June, something like that.
hmm
So anyway, so we came in, tested them. So the day of boards, we can't, as far as NERB at least, I don't know if your region, Andrew, but we can't use local anesthesia.
Yeah, we're gonna have some. We'll talk
Yeah,
about ours in a little bit. We're way
yeah,
different on what our
yeah.
clinical boards are.
They only allowed us to use Orkix, like topical, which is for me is
Sure.
mostly worthless. Not for every patient, but some patients. So of course, when my cousin came in, like he basically, I wasn't scaling. I was kind of, exploring around and probing and all that, and he seemed fine. So the day of the clinical boards, he comes in, do all the paperwork, yada yada yada. I finally get him in the chair, and all the teeth that I chose. I start my scaling, and he's like sensitive, like,
Wow.
what?
Jeez.
He's like, I don't think it was gonna be like this. I'm like, what? You get all stressed out. So that was part of it. He wasn't ideal as far as that goes. And then, so when I finished him, I still felt like a little bit on one tooth. So, and I was like, I used my after fives. I used like everything I had, like Gracie's and
Mhm.
Cavitron and all that. And of course, our skills in hygiene school are not really good. So, I mean, the way I am today is not what I was at that day. So,
Right,
so
right.
my skills were very mediocre. So I still felt a little bit, but I couldn't get the damn thing off. And I was just hammering at this guy for a while. So I had to give up at a certain point, and then he went back, and then the examiners check him and so on and so forth. So I went back, I sat down, like everybody's done, and I'm thinking like, I don't feel good about that at all. I don't feel good about that at all. Of course, everybody else is like, yeah, I'm sure you're fine. You're fine. Like, so like for like a month and a half, they're like, oh yeah, you're fine. You're fine. But like, but the back of my mind, I'm thinking maybe I'll get like 10 points off for that one tooth or something. But
Sure.
so of course I'm stressed about that, and I'm waiting and waiting and waiting. And then I got the letter in the mail, from NERB. I open it, and I'm like by myself, and I'm thinking like, please just give me a 75, because 75 is passing, I opened the thing, I got a 69.
Oh no.
And I was like, and I, like out loud to myself, I'm like, come on, seriously, like I don't need this right now, And then I was like, I would say after about 2 hours or so, I was like, all right, this is a reality, I have to take it again. And I couldn't take it and I found out like in late May, early June, whatever it was. And I couldn't test again until late August. And I was already scheduled to go to Peru on my mission, which kind of dampened my experience, because like the whole time I'm like thinking about this, I have to go find the patient, blah, blah, blah.
You couldn't find one in Peru that you could just bring up?
I should have paid somebody to come with me. It would have been cheaper, actually.
Yeah.
But even my second experience was not that good, Andrew. Like, because I ended up getting one of the patients that was used by 2 students, because he built up calculus, pretty easily. Plus, he didn't have all his teeth scale at the time. So when I came back, I got him, through my classmates, contacted him and everything. He was kind of a Yahoo guy, but so now instead of having the boards at my school, I had to go to Tufts Dental School in Boston, which is a pain now, way more of a pain, because I have to drive him and me to Tufts, and go to Boston, blah blah blah, all day. Anyway, so I got him. I ended up taking him to my professor's office to test him, because now I'm out of school, so I don't have the clinic to use.
Right.
So I took him there. He was like a easy patient, like that white soft calculus that builds up. It's like perfect. Like him compared to my cousin was like night and day. It was like super easy, So I ended up paying him like a lot of money. I paid him like $200, because he had to go to Boston and all that with me. So, so he qualified. He was all for it. And when August came around, we had the plan, for the day and everything. So I was going to pick him up at work. He was an auto mechanic, right? I didn't know this till I got there, but so it's like early in the morning, I go pick him up at this auto shop, and I'm like, hey man, what's up? Ready? He goes, okay, I'm gonna go tell my boss that I'm leaving. Come to find out, that was a new job. He just started there like a week before.
Oh no.
And his boss is like all pissed off, yelling at him, like, where you going? Like, where you? And then he's like, I told this guy I can go. No. I was gonna be his patient, for the board, blah blah blah, the dental thing or whatever. Yeah. I was like, oh my god. I'm like in the waiting area, like waiting, like, oh my god, is this guy not gonna go like to the clinic? He ended up leaving, and I don't know if he got fired or not, but his boss was pretty pissed off. So we drive up to Boston, go up there. It was pretty straightforward from there, though. And then we, I saw him. I had to wait till like September for the results. More stress, but I felt a lot better with his treatment. But of course now I'm like, I could fail. Who knows? What I'm saying? Like something stupid. So I got my results back. I got 100%. You know what I'm saying? It's like,
From a 69 to a 100, huh?
Yeah.
And you probably didn't have that much time to practice in between.
Except for scaling in Peru, pretty much. That was only, yeah.
That's kind of interesting. So all of a sudden your clinical skills got that much better all of a sudden with no practice. So good job on that.
And that's the issue with the whole exam. Like from what I've researched, is basically almost 100% of people pass like the second time around. It's like close to 100%. So what does that say about the test? If nobody's getting more training, actually it's even worse, because they're not seeing patients anymore. And then like 3 months later, they pass. Like what's, you know, I
Our
was like,
our school was a little bit different. We now we also, I don't know if we have more board exams than you or what, but and first of all, let me back up and say, from what I've heard, just being around the dental hygiene community, the NERB is one of the harder ones to pass, from what
yeah,
everyone says. I don't know if just the testing people are just really strict, or if you guys just have more tenacious calculus up there. I'm not really sure.
I don't know.
But we also had the national board that we took. Then we had our REB is what ours is. We had the anesthesia REB, which is a clinical, and then or we had the didactic and then the clinical are two separate ones. If you don't pass the written test, then you can't take the clinical test. And that was in February. So that was all before our boards. So when our boards came around for the hygiene boards, we can give anesthesia. So that was really nice. And that probably factored into a lot of us passing, because we could just kind of go to town on the patient and not really worry about, because I mean, Retakes is fine. It's just not
It's not. Yeah.
a magic pill, you know? And so we could do all of that during our board exams, and we still had several people out of our class fail. My brother was one of those. He failed the anesthesia one. We also had in the same weekend our restorative boards, and so we had a composite that we had to do and an amalgam we had to do, and so there's just a lot of stress. Those are on your typodonts or dentiforms or whatever you know them as. And so in one weekend, we ended up taking pretty much 3 different exams. And for us, we didn't have the boards at our school. We had to go up to Spokane from where we were at, and it was about 3.5 hours. So we had to, and ours started really early in the morning, so we had to stay overnight. I ended up probably paying about $1,000 for the whole experience, between paying my patient, giving him a hotel room, giving him food money and stuff like that. And then I was just one of the lucky few that I passed, but then so many other people didn't pass. And then they were looking at going to like Oklahoma to take theirs. So we could have taken ours the very next month. And then if we didn't pass our boards, our hygiene program was pretty cool that they would let us do like remedial coursework. And so we could actually go to our school and do some more extra work with some of our instructors. They were really nice about that. But it's thousands of dollars every time you're trying to retake it, and you have to try and find a patient somewhere, and you're trying to steal the patients from the junior class and
Right.
try and get their stuff. It's kind of a weird thing. And then of course you clean the one quad, and then what's going to happen for the other 3 quads? You're like, well, I guess you'll see the next class. Good luck with that.
Yeah.
And you're just leaving them.
Yeah. Yeah. I mean, it's, I don't know. To me, it's like we were saying before, Andrew, I mean, it's definitely important to have a third-party verification of your skills in some way. I think there's better alternatives than that. One idea that I mentioned in the blog post that I wrote, for those that know, I did a blog post about this too, and I also got into the whole idea of the one-shot, one-day type exams and some of the alternatives out there. One is basically what New York does for dentists, is they can do like a 1-year residency basically, and they get paid less obviously, but they basically get observed for a year by experienced dentists. And those dentists, which are not part of the school obviously, you know, they verify that person's skill set over a year, you know, and then they can get their license without taking boards if they go through that process. So I think that would be nice for hygienists to have, you know, dentists that are willing, plus they can get cheaper labor, I guess, for a few months, right?
Right.
You know, like maybe even 3 months or whatever it is, you know, 3 months, 6 months or whatever, you know, go into a dental office that's willing to do this and work for them at a lower rate, and they have to report to the board, you know, like how you're doing, progress report. So I mean, whatever they come up with, I mean, whatever the plan is.
Sure.
That's one idea. The other idea is to have like a portfolio, not so much like how we had in school, because the one we had in school wasn't that great. I mean, I didn't like how we did it, but just a portfolio of all the patients you saw in school, and a very comprehensive kind of write up and maybe photos and all kinds of perio charts and whatever, just over time, like maybe like the last year of school, last semester of school, or whatever it is, something like that. There were some other ones, but I forgot what they were. But to me, like I don't like the idea of just a one-shot type thing. What are your thoughts
Well,
about that?
it's kind of, and I know that you and I have talked about this before, but it's sometimes unfair to the person that really is prepared, the person that if we did have a portfolio type system that could say, hey, here are all my cases that I've done. Here's the things that I've learned. And I like clinical photography. I like it a lot because I think, a picture is worth 1,000 words or whatever they say. And so if you could present that to the board and they can just review everything and say, okay, yes, they've met this, they've met this, they've met this. And you can see your overall coursework and all your overall progression. I think that it rewards the people who truly worked hard. And I think that the people who maybe are kind of skated by, which there were several in my class that, well, not several, there were a couple in my class. And I'm just like, I really wish you wouldn't have passed. I don't know how they passed because all year long they were, never showing up for class. And then they would get poor marks. And they got really lucky.
Mm-hmm. Yeah, I agree. There's a lot of students like my class too that kind of went through the program. I think there is that incentive for schools. Obviously, the more students they have, the more money they get. So they want students as customers. But I don't know, maybe like a third party. I mean, whether it's the ADHA or ADA or the board or whatever, like go in and audit the school, which they go through auditing process, for accreditation and stuff.
Accreditation,
yeah. So I don't know. I mean, whatever they come up with, I just like the idea of it being over the long term and nothing that's one day. Because, I mean, somebody can come into our office now and like, even if you have 10 years experience, if you have a very difficult patient and they actually checked everything you did, I mean, all of us would fail at some point. Saying like, hey man, you didn't, that probing depth is a little off. Yeah, well, the patient was moving a lot.
Yeah. And I've definitely had doctors that have gone back. The last doctor I worked for, he went back occasionally and checked my probings and be like, Andrew, you're more than a millimeter off on this one or whatever. Now, I think it maybe was just the way he was holding the probe.
Like
a little bit to the side. He was going past the coal and to the other side, or
the opposite side. It's a 10 millimeter pocket.
Yeah. So I mean, I think that there are things that happen like that too. But I like it when doctors go up and check on my work, and as long as they're not making a big fuss out of it. And again, I'm going to tell you the truth. I've missed a piece of calculus before.
Oh yeah, we all have.
And he went back and said, Andrew, clean up the distal of 14 real quick, and then they're good to go. Very professional about it. And so, yeah, I mean, we're all going to make mistakes, but I think, it's the bigger picture that we need to worry about.
Mm-hmm. The other issue that I wrote about in the blog post was the ethics of it too, because we always talk about perio and it's a chronic infection and it affects the body. It's a very systemic thing, and then we find a patient and then we ask them, oh, can you delay treatment for a year? Yes. To be my board patient. Yeah. So some of the stuff I was reading that, that's an ethical issue. And in dental school, it could be where they, do a class 2 on a tooth, which probably could have been a watch in some cases, that kind of stuff. And I think other countries too have stopped that live patient exam. I think Canada might be one of them. I don't recall right now, but so yeah, I mean, there's definitely ethical issues with that too. But
and with the stopping of, and I would probably disagree with that. I would still want them to do live patient exams because I've also worked for doctors that have come from other countries that, whether or not they have live patient exam, I think that their clinical judgment is quite a bit different. And I think if you're not working on a moving, living, breathing, squirming patient and then being assessed on your skills, which would go back to what you were saying earlier, is maybe having a portfolio and being able to prove that through 4 years of dental school, through 2 years of hygiene school, or 3 years of hygiene school, however long you take, that this is, the culmination of my work. It's just not fair.
Mm-hmm.
It's not accurate, I guess I should say.
I mean, if I had to choose, I like the idea of doing that, like 3 month, 6 month residency, or call it whatever you want to call it, but where you have dentists and hygienists, experienced hygienists, either or whatever it is, who would actually watch you, not just like let you sit and see patients and just say, yeah, that's good, but actually like check you, like consistently over time.
And
I like that as best.
I think that, let's say if it was a 3-month one, it wouldn't be any longer than the time that you had to wait for your license anyways.
Right, exactly.
Which by the time you get your test results, and then by the time you submit that to your state, and then by the time state finally gets back to you, it's about 3 months.
Yeah. Plus that might actually help too, whether it's like community health centers or whatever else they set up. I mean, you can like see, we always talk about access to care and patients that can't afford care, and maybe they can kind of tie those two together, like have patients that don't have insurance or can't afford it or whatever, go into these residencies and see hygienists that are obviously already trained. They're just new, so that might work out. But I think it's too much money in these exams, though, Andrew. People that have like
you can get that money a different way. Yeah. I think.
Yeah, exactly.
Just make the license cost more or something. I don't know.
Yeah, exactly. I think dentists have the same. I hear stories too. They have the same issues with these exams. They fail, and it's, in my case, like I kind of set myself up so I would be pretty comfortable. I was in the Air Force, as you know, Andrew, and I was like my last 2 years. I basically lived like a monk. I bought nothing. I had no cable TV. I had nothing, and I just saved money. So I had like close to 30 grand when I got out. Plus I had the GI Bill. So I basically profited off school. Like I got a little more than what actual school cost.
Sure.
Plus I had my savings and all that. So, but then it took like 2 years to get into hygiene school, for obvious, it's just, politics and stuff. It's tough to get in sometimes. So I was, my last 2 years in the Air Force, I was just saving money. And in those 4 years, like I was just taking my general courses first and taking extra courses too, because I was kind of enjoying just being a college student, taking extra courses that I wanted to take. So as like a 6-year time frame where I couldn't afford to, spend money basically. And, but so my money pretty much ran out right at that point too. So like right at the time I was supposed to get my license. Yeah. Now it was like a 3 extra months of basically my savings were gone, and I ended up cashing out an IRA. I had I think I had like 5 grand in it at the time.
Oh no!
Of course, I got penalized tax wise and all that, but I had to, And then I passed, and of course at the time in 2007, like hygienists were in high demand, like so it was super easy to get a job. So that wasn't an issue at all. It was just waiting for the license, So I just basically had to cash out my IRA, and that was enough to live, for a couple of months. And then I got my license finally, and then I got a job right away. So then I was making money, for the first time in 6 years, But I mean, I still feel lucky in a sense that a lot of hygienists in my area that like go to private school, especially. I work with 2 hygienists that basically one had student loans of 100,000, and one was 60,000. I had no debt, So I was very lucky in that sense. But yeah, so it was awful. It was like a double whammy, failing the test and like not having money.
So by the time I graduated, I had 2 children. So my second son was born when I was a senior in the program. And then we took out about 60,000 in loans. I was also working night shifts and stuff like that, just getting minimum wage or just a little bit above. But if I didn't do that, then we would have been $80,000, $90,000 in the hole. Yeah. And then where's that money going to come from when you're, take your boards patient to Oklahoma or whatever?
Yeah.
There are some more loans. So it's got to be rough.
Yeah, it sucks. And yeah, so I kind of wanted to share the story with other hygienists. So when they Google failing clinical exams, they're gonna come up with, hopefully they come across either the blog post or this video on YouTube,
Sure.
and just so they don't feel like they're alone. I mean, there's no way to minimize it. I mean, it definitely sucked because, I mean, if you're a student, I'm pretty sure you're stressed for money, so it's going to be a stressful situation either way. And I mean, obviously now, like, it's what, 8 years later, it's not really a big deal in the big picture, right?
Right.
Because I made a lot of money since. But
how many people would you say from your class ended up having to retake some portion of the boards?
it was 2 of us that failed clinical, and everybody passed everything else. But
we had people that were kind of the restorative board. A lot of people failed the restorative board. Probably, I think at least 5 did. I don't remember anyone failing the local anesthesia board exams. Maybe a couple might have failed the written part, but they nailed it the second time. And then quite a few people, probably 4 or 5 again, ended up failing the hygiene board. I mean, so it's very, I don't want to say it's common, but I mean, it happens in almost every single class. I don't know that one class, no matter how great the teachers are, they can't take the boards for you,
Yeah.
So it's going to happen. It's nothing to really feel that bad about other than the fact that you're going to be poor.
Yeah. Yeah, exactly. Yeah. So that sucked, that was, so hygienists out there that do fail. Like for me, like failing the clinical boards, because I don't really agree with the assessment. I don't think it's a real good assessment of your actual skills, even though our skills suck at that point in general. But for me, so it wasn't so much like, oh my God, I don't know how to scale. Like that never crossed my mind. Like for me, it was just, I had a difficult patient. It wasn't ideal, and it just didn't work out. So I knew in my head that if I got a good patient and nothing went wrong, I would pass. So I mean, that wasn't really a question in my head. But with national boards, if you do fail I think that would be more difficult, because it's like, dude, I don't know what to study. Like, I don't know.
Yeah, and I know there's a lot of board review courses out there you could probably take to kind of help. At least I think a lot of it is people are just so anxious about it that they kind of freeze up. So if you do some review courses, that'll probably help out. As far as the clinical hygiene portion, I guess my recommendation to those that are struggling or worried about it is, yes, start early, find a great patient, clean at least one of the quadrants. I'm not sure if that's it's allowable with the NERB, right? But I mean, you should have one quadrant that you want to clean, then one alternate quadrant, and then you have 2 more quads left. So work on those ones for some of your in-class work and see how that goes. If you're a righty, my preference is going to be do the upper right, just because it's the ease of cleaning that area. To me, in my opinion, is easier. It's easier to kind of manipulate the inserts of the cavitrons. You're not going to have the crowding of the lower anteriors.
Yeah.
And I find actually, if you have, between 30 and 31, I still struggle a little bit getting the cavitron tip adapted perfectly unless you have the right and left inserts. But be choosy. And one last thing about that is, you're probably going to steal the patient from somebody else that either is wanting to do them or has already done them. And you shouldn't feel bad about that, because that's just the way it goes.
Yeah, exactly. Yeah. Yeah, I would say the same thing, Andrew. Like, I think one of my mistakes was to not test my patient. But I think in my case, because you have to get, like, I forgot what the criteria was, but it was like at least 1 or 2 or whatever it was, at least 5mm pockets, and a few could be 4, and then sub or whatever it was. But in his case, I had to go to like multiple quads, not every quad, but I think 3, at least 2, but maybe 3 quads. I had to like pick and choose like certain teeth to qualify.
Oh, yeah.
But some patients like just have it everywhere, to me, I mean, if you can find somebody that builds calculus fast, which my second patient did, that's just easy to clean. It's just super easy.
Mhm.
Like, you don't want tenacious calculus
No, you
patient that
don't.
say, "Oh my, yeah, I had cleaning like 15 years ago." I was like, "Oh, I don't know. I think you're the wrong patient for me." You know?
Definitely give it a test first and see
Yeah.
if it's tenacious. If there's a lot of black sub coming out, then
Mhm.
maybe that's not the way you want to go.
Yeah.
Because they can tell if it's burnished. I mean, they'll
Yeah.
knock you off real quick.
Yeah. Exactly. Yeah. So if any hygienists out there want to email me or contact me, like on the blog or whatever, if you have any concerns about your exam, or if you failed yourself and you want to cry, just send me an email and I'll answer any questions you might have. Because, like I said, it's on the day that it happens and you're a poor student still. It's like it's the worst thing, and you just have to get through it, I guess. I mean, it's all I can really say. It's gonna suck, and you just basically, at some point, you have to realize, okay, this is the reality. Let me move forward and find the patient and schedule for the next exam, which in my case is every 3 months. I don't know about your area, Andrew, how often they do it.
I think the rep is bigger, so I think you have more options.
Yeah, you
There's
probably go to
probably,
different states, right? Like to do
yeah,
it. Yeah,
a lot more states are participating, and it's geographically a lot bigger. So
yeah. Whereas NERB is, I mean, I guess you can travel, but I mean, for NERB, it's like I think it goes down to like New Jersey and New York and stuff. I don't know how far down it goes, but the idea of trying to drag somebody somewhere, that
it's
just sounds
expensive.
even worse.
Hmm.
Yeah, but so that's all I got, Andrew. I mean, that's the basic story. I mean, it's if you failed your clinical, don't feel bad. Don't feel like you suck as a hygienist or you're not a good hygienist or whatever. I think it's just the flaws of the system. In general, generally speaking, maybe you do suck. I mean, maybe it's one or two out there that really do suck, but I think I don't like the system, and even national boards too. Like, me personally, I take tests pretty well. I test well, and I know some people that's not their thing, and they
Mhm.
might actually know the material in general, but when they sit down for an exam, they just either panic or they just that style exam is just not their forte, I guess.
Mhm.
So even that, like, I don't feel too bad either. But yeah, so
And I couldn't agree more to all of
yeah,
those points.
yeah. Well, that's all I got, Andrew. Anything else? I think that's
I'm good. Best of luck to everyone out there. And if you need a shoulder to cry on Mark's, not mine.
yeah, yeah,
So
yeah. Just check out my blog at markhardeh.com and just start crying, I guess. Yeah. All right, Andrew. So I'm gonna stop there.
sure.